Good afternoon. My name is Carol Pandak, and I am the director of the PolioPlus program for Rotary International. I oversee, in support of Rotary leadership, the PolioPlus program. So to date, we have 88 cases of polio in Pakistan and Afghanistan. These are the only two countries that are reporting cases of polio. Before we get into that, though, we also want to mark the progress that we've had. Right? We all know Nigeria has gone over 3 years without a case of polio. That's a huge milestone. And it's the last country on the African continent that has polio. And so this paves the way now with the 3-year mark for the entire region, all the countries in Africa, to be certified polio-free. That paperwork is being submitted by the countries to the Africa Certification Commission, the Regional Certification Commission. They will look at all that data and make an independent assessment that will be provided to us sometime in mid-June. So we could have another major milestone in polio eradication coming up very shortly. We have seen an increase in cases in Pakistan and Afghanistan over the past couple of years. And a couple of reasons for that. First of all, I'm just going to say don't get discouraged. I mean, one of the reasons it can be because our surveillance is that much more sensitive. Pakistan has the largest polio surveillance system of any country in the world. So they have not only are looking for children with cases of polio, but they're testing over 50 sewage sites to see if they can detect the virus in any sewage. So they're probably picking up more cases of polio than they ever had before. And that's a good thing, because we need to have that level of sensitivity going forward in order to certify the world polio-free. And talk a little bit about Afghanistan. We've had a bit of a breakthrough in Afghanistan. You know, there was a ban on immunizations, right, in Afghanistan, and it was kind of 50% of the country for a while. Your gold standard for immunization is going house to house. That wasn't allowed. About 5 million children were not being immunized. So then they went to a kind of a site-to-site program where you would have to bring your children somewhere. And then there was a complete ban. There was no child getting immunized. There's been a bit of a breakthrough. The Taliban is allowing site-to-site immunization. And I was just at a meeting in London learning more about this, because almost like, so in clinics, they're going to be able to immunize children. But then you think, gee, how many clinics do they have in Afghanistan? Yeah. Maybe not a lot. They have these areas that are called white areas that have nothing. But what they're going to do, and they're going to ask Rotary to help support this, is do almost a pop-up clinic in people's homes, in respected leaders' homes, that will be considered a clinic to try to get into many more areas than you would with the regular clinic system. So we're looking forward to starting to immunize kids again in Afghanistan, which is a good thing. I can talk a little bit about Pakistan. I think Pakistan is a really complex situation, John. It's got, not only do you have these false rumors about the safety of the vaccine, they had that issue up in, what was it, Peshawar, yeah, up north, where some man did a video that he had children faint after they'd been, and said they were given polio drops so that they were being sickened by the polio drops. That turned out to be completely false, but it got out on social media. And then parents have lots of other needs for their children. We're going with polio drops. We're not delivering any other services. So the strategy now is to work really hard with other partners to help deliver some other health services along with polio drops to bring the parents along.
Well, I think that there's a lot of things to be added to it. First of all, in Africa, for example, that we still have the vaccine-derived polio, and that's getting confused with the wild polio virus. So hopefully that after World Polio Day or shortly in the near future, there'll be some positive announcements that'll come out of Africa and everything. I think, Carol, I think that people are really working hard, and with our Rotary leadership there with Tunji and all the work that he's doing, reaching out to be sure that all the cases are gone.
Yeah, and on that front, the circulating vaccine-derived virus versus the wild virus. I mean, the big news there too is the the potential introduction of a new vaccine that doesn't have the same, it's much more stable than the current oral polio vaccine, so it wouldn't be able to cause that circulating vaccine-derived virus, and that could be out as soon as June also.
Yeah, and that's
2020.
one of our partners, the Gates Foundation, is doing a lot with that.
Yeah, really pushing
And
that hard.
WHO, one of our other partners, is working hard to get this expedited so that we can have that vaccine much sooner than we normally would get it through the FDA approval and everything. So it is the partnership that's making this entire process very successful, I think, and we need to be proud of our partners. And of course, one of the things that Carol was talking about, the number of kids that we have to reach at over 400 million children that's less than 5 that we have to get every year. I mean, just think of the economic value that cost of that when we try to reach that many children. And think about, she mentioned the increased surveillance in Pakistan that's going on now. Well, think about trying to do surveillance in 70 different countries that we have to do surveillance in. And, it's not a simple matter, to say we're going to eradicate polio. It is a very complex, this virus is probably the most terrible virus that has ever existed or ever been identified. And it's one that's vicious, and it only carries in the body, but it lives outside the body for about 48 hours. And so you can get it, though, very quickly. And it's going to attack the most vulnerable of our children. We're spending about $900 million a year. And that's a lot of money. And that's why we have to continue to raise money every year. And thankfully, back in 2007, the Gates Foundation believed enough in Rotary, believed enough that Rotarians would live up to their commitment to eradicate polio, that they gave us $100 million without us even having a campaign chairman, a campaign, knowing how we're going to do it. And Bill Gates told me one time he did that. I asked him, I said, why did you do this? You could have given it to anybody you wanted to. He said, because I believe that Rotarians will keep their word. They have the capability, they have the stewardship, and they have the faith that they're going to accomplish the job. And I think we have to continue to do that now with our new agreement that we've got through 2023 of $50 million a year. We've reached that goal every year so far. It's getting harder every year.
As we heard this morning.
It is much more difficult every year, but we've been able to do it. And so far this year, we're ahead of where we were at the same time last year.
Yeah.
So we are there. We also have to understand that we have about 100,000 new Rotarians every year.
Yeah.
We're pushing for younger Rotarians, which we should be doing. They barely can spell polio.
That's a good thing, right? Because they don't know it.
They don't know anything about it. That is a good thing. We're also facing the situation that in the United States and a lot of places in the Americas, and as well as overseas, the anti-vaccine scenario that we have to worry about.
Yeah.
You may want to talk a little bit about that how people are scared of the vaccines these days.
Yeah, I think it's different in different places, right? The anti-vaxxers in the United States have different reasons than maybe those that are refusing vaccinations in Pakistan, Afghanistan, because they have no services there. Here we have a multiple of services. People haven't seen the disease, so why do I have to immunize my child against the disease? But what I think is really, really neat is that Rotary at the highest levels and our partner agencies, are on top of this issue in Pakistan and Afghanistan. They're planning a trip with the World Health Organization Director General, the President of Global Development for the Gates Foundation, Rotary. I think CDC is sending a person to go to Pakistan and to Afghanistan, Kabul, visit with government leadership, with partner leadership, really expressing, the urgency of both those countries getting their programs back on track. I think the issues in Pakistan and Afghanistan are different. You've got sort of an access issue in Afghanistan, so you've got to kind of negotiate that in a very different way than you do where you've got really high-level political commitment in Pakistan, but how do you bring that down to these remaining areas that are really quite contentious?
We also have a very porous border over there, too. It's a very long,
a huge mobile population.
Mobile population back and forth that
hard to track.
It's just almost impossible to track it.
But you know who did that incredibly well was India. They finally figured out in the end it was the brick kiln workers that were moving from brick kiln to brick kiln, these migratory populations that were carrying the virus. So they tracked this movement, they tracked every single brick kiln, mapped it all, and then that's where they went to find the last cases of polio.
That's also why we have to get the buses and the trains and people where the entry points, and that's what Rotary with their health caps and the things that we've done in Pakistan to develop those health caps to attract people there to put that little mark on their fingers.
Exactly. And that's why we have donuts that have purple pancakes.
That's why we have donuts, and that's why we have various fundraising efforts to reach our goal.
So I think this thing with measles is a good example of because people stopped vaccinating, what is it, about 7%, right? In America, I think they say, that we got measles outbreak again, which supposedly we're gone, right?
Yeah.
And so with travel today, you could bring polio back to kids who haven't been vaccinated, right?
Yeah, I mean, this is what we've been saying forever, right? Polio is a plane ride away. Yeah, as long as it's, and we did an analysis once of how many flights, this is quite a while ago, how many flights were coming in from those countries that still had polio into the United States. I mean, you don't want to stigmatize people either, but you know, it's not few.
Well, it happens.
Yeah, people are traveling.
It happens, and you know, and we're not going to be polio free until we get all the children free.
Yeah.
And we're not going to be polio free until we can get not just the children free for a period of time, but we've got to get the people to understand that all the new kids have to be vaccinated. So even if we got through in Pakistan, Afghanistan, and Africa, and all the other countries, we still got to do it until it's all finished. Fortunately, I think that we've got the partnership with UNICEF and CDC and WHO and the Gates Foundation, and Gavi is a manufacturer, a supplier of vaccine, not manufacturer, they're supplier of vaccine that they're getting on board now to say, we're going to help you, we're going to help provide. But we've also got to remember that we got routine immunizations that have to happen all the time, too.
And that's where Gavi is going to really be helpful, because Gavi focuses on like routine immunization. So one of the things we know is that we need to strengthen routine in order to support our supplementary activities. So I think Gavi coming in, they're going to be providing $800 million worth of inactivated polio vaccine over the next, I don't know, through 2025 or something, is really. But it's not only that, because they're working out there on health system strengthening, immunization system strengthening. This can kind of work together to kind of get us over these final obstacles that we're facing.
And I think Carol and I are just looking forward to we can say that Rotary has finished its job. Right?
I think nobody looked forward to it more than John Germ, and then second of all, Carol Pandak.
No, I think it's vice versa. Either way, we're both looking forward to having it done. But I'd say that we need to be sure we thank everybody for all the work that has been done. District 67080 has been a forerunner in this. We had the first chairman of the IPPC came from here, Bill Sargent, who devoted about 12 years of his life in order to help eradicate polio, traveling around the world. The district has been very supportive financially. They have been very supportive of going on NIDs and working. And we just need to educate our new Rotarians, and we need to continue to say we need their financial help. As long as we have to provide vaccine, and Rotary is paying for vaccine now in some cases, that we've been able to do that. So thank you very much for your help. Continue to support us. Let's finish this, and let's fulfill our promise to the children of the world that we will eradicate polio.